A special thank you to each of our subscribers who make this channel possible. Here's today's story. In a significant shakeup at the Centers for Disease Control and Prevention, CDC, the White House has appointed Deputy Health and Human Services Secretary Jim O'Neill as the acting head of the agency. This decision comes in the wake of a tumultuous period marked by a clash over vaccine policies that led to the departure of several key officials and widespread unrest among CDC staff. The recent developments have raised concerns about the direction of public health policy in the United States, particularly under the leadership of Health and Human Services Secretary Robert F. Kennedy Jr. and President Donald Trump. O'Neill's appointment follows the dismissal of Susan Menarez, who had only been in her role as CDC director for less than a month. Menarez was reportedly let go after she refused to resign, with White House officials stating that her leadership was not in alignment with President Trump's agenda of making America healthy again. This abrupt change in leadership has left the CDC in a state of disarray, with hundreds of employees staging a walkout at the agency's Atlanta headquarters in protest. The walkout was a response to not only Menarez's firing, but also the resignations of 3 other top officials, including Deb Oury, Demetra Daskalakis, and Daniel Jernigan. During the protest, which was organized to show solidarity with the departing officials, the atmosphere was charged with emotion as former CDC leaders were escorted out of the building. Daskalakis, who had served as the National Monkeypox Response Coordinator under the Biden administration, expressed his reasons for resigning in a heartfelt message, invoking his grandfather's legacy of standing up against fascism. He criticized the current administration's approach to public health, particularly the recent changes in COVID-19 recommendations for vulnerable populations, which he deemed reckless. The situation at the CDC has drawn widespread attention, as it reflects a broader struggle within the Trump administration regarding the handling of public health issues. Critics argue that the administration's focus on political alignment over scientific integrity could jeopardize the nation's health response, particularly as the country continues to navigate the complexities of the COVID-19 pandemic and its aftermath. In response to the growing unrest, the White House has defended its actions, asserting that the changes are necessary to align the CDC with the administration's vision for public health. However, the backlash from health professionals and agency staff suggests a deepening rift between scientific expertise and political directives. The resignations and protests highlight a critical moment for the CDC, as it grapples with maintaining its credibility and effectiveness amid shifting political landscapes. As the acting director, O'Neill faces the daunting task of restoring stability within the agency while navigating the contentious political environment. His background as a Silicon Valley investor and previous roles in government may provide a unique perspective, but many within the agency remain skeptical about the future direction of public health policy under his leadership. The fallout from this leadership crisis at the CDC raises important questions about the future of public health in the United States. With midterm elections approaching in 2026, both parties are keenly aware of the implications that public health policy decisions could have on voter sentiment and electoral outcomes. As candidates begin to rally support and energize their bases, the handling of health issues will undoubtedly play a pivotal role in shaping the political landscape. In the meantime, as the CDC navigates these turbulent waters, the public health community watches closely, hoping for a return to a more science-driven approach to health policy. The situation serves as a reminder of the delicate balance between politics and public health, and the importance of leadership that prioritizes scientific integrity in the face of political pressures. As the nation continues to confront ongoing health challenges, the effectiveness of the CDC and its leadership will be critical in determining the trajectory of public health in America. That's all for this story. We upload videos every day covering many different subjects, so hit that subscribe button to stay informed. Thanks for watching.